Through this video, let's see about motor neuron disease. Motor neuron disease is a disease which presents with weakness and various corticospinal symptoms in patients since the motor neurons are affected. This disease presents with both upper motor neuron and lower motor neuron signs. The causes of motor neuron disease. The exact cause of this disease is still unknown, but it is mostly inherited and sometimes it is due to the environmental factors and due to glutamate toxicity. The pathology of the disease. This disease is mainly due to the degenerative changes which occurs in the motor neurons. The motor neuron shrinks and they are covered by the lipids. This process is called as lipofuscin. Since the motor neurons are affected, the patient presents with motor symptoms such as atrophy of the muscle, weakness of the muscle, etc. If we will see about the clinical features, it is based on which type of motor neuron disease. Motor neuron disease is of four types. They are the amyotrophic lateral sclerosis, the primary lateral sclerosis, the progressive bulbar palsy, and progressive muscular atrophy. The most common type is amyotrophic lateral sclerosis and the patient presents with both upper motor and lower motor neuron signs. In primary lateral sclerosis, the patient presents with corticospinal and corticobulbar symptoms. When coming to the progressive bulbar palsy, the patients mostly show bulbar symptoms such as dysphagia, dysarthria, etc. And when coming to the progressive muscular atrophy, the symptoms mostly starts with the limbs, that is weakening of muscles in the upper limb, mostly unilateral, and then when the disease progresses, it advances to the lower limb and it becomes bilateral. When coming about the diagnosis part of this muscular motor neuron disease, we can find that the patient presents with both upper motor and lower motor neuron signs, and along with this we can perform electromyography and nerve conduction studies to rule out this motor neuron disease. Treatment of this disease in medical management, the most commonly used drug is riluzole, which is used for managing this disease. On coming to physiotherapy management, it is mostly based on managing the symptoms. We physios mostly concentrate on managing the symptoms such as weakness, endurance of the muscle, fatigue of the patient, swallowing difficulties of the patient, especially in the bulbar variety, and respiratory complications of the patient. Bye for now. Follow for more topics.